This episode on Substance Stories, we're going to be talking about the famous 5, the key support structures for finding and keeping your recovery. Today, Ferghal, we're going to talk about the support structures that are needed for someone to achieve and maintain recovery. I think it's really important to talk about this because for some reason, even though addiction is a medical illness that needs, to be treated by professionals and with the support of medically trained people, people don't treat it that way. So I always think about, often family members are trying to run and treat someone's addiction. I often use the example of diabetes, and if I had diabetes, it would be madness for my wife to take on the role of my endocrinologist. But often families do this with addiction, and I've never seen it lead to a good result. And so one of the things I really say is I think the family's role is to be a loving support, and there are professionals whose role it is to help. And what sort of professionals would you include in that list of people to help, Ferghal?
So before I go to that list, I would also add that in my experience, I meet people who say to me that they can do it on their own. So not only are we seeing people who think that their family members are all the supports they need, but we also see people who are the lone rangers. And unfortunately, there are no lone rangers in recovery. You cannot do it on your own. So you need as many supports as you can get, but there are in particular 5 kinds of support that I think are really important in your recovery. And, as you know, Richard, we call these 5 the famous 5.
Fabulous 5. Oh, the famous 5. Sorry.
The famous 5. I don't know. Do you call them the fabulous 5?
No, I'm just messing with you.
All right.
Okay.
So the fabulous 5, the fabulous 5, the GP, the specialist, the psychologist, the accountability partner, and the sponsor. So I think it's important for us to understand what these individuals are and how they can actually help people in their recovery journey. So I would argue that everybody needs a GP, even if you don't have an addiction, even if you're not recovering from an addiction, you still need a good GP.
Indeed.
So what do you think about that?
The point of a GP is that it's someone that knows you over time. It's someone that's available, which is getting increasingly hard in Australia to find a GP with availability, and someone who's aware of the whole picture, right? They're aware of all your conditions. They're I always think about this sort of the ringmaster or the quarterback of your medical management. So it's really important, especially if you have a chronic illness like addiction is, that you have a GP that knows you, knows who you are, knows your previous treatments, and can be the waylay point between everyone else. So it's really important to have a GP that you know and who knows you.
I mean, on that note, I would argue that everyone with diabetes knows who their GP is.
Absolutely. Well, everyone with diabetes knows who their GP is.
But in my experience, I see a lot of people who don't have a GP. In addiction where we work, we see lots of patients who don't have a GP, and that's such a sad thing. I think it's an indictment on society here, and I think it reflects the stigma that people experience.
Yeah,
the institutional stigma that people experience.
I was just about to say that. I think that for a lot of our patients, it is not the patient's choice that they don't have a GP. It is stigma towards people who have suffered from an addiction by GPs. The second one that you mentioned is an addiction specialist, Ferghal. And as an addiction specialist yourself, is it not incredibly self-serving to say that everyone with an addiction needs to know an addiction specialist?
Well, that's a very interesting point, which I will address after I've actually made the distinction. We need to understand what an addiction specialist is. So I think we need to include in that definition addiction psychiatry and addiction medicine specialists. Now, I think your analogy of diabetes is really useful to address this issue. Yeah. Not everyone with diabetes needs to see a specialist endocrinologist. Not everyone with diabetes.
But they should know an endocrinologist.
They should. Well, I mean, people with dietary controlled diabetes under the care of a good GP, I think, do not need to actually see an endocrinologist. Sure. But, there are gradations of severity in diabetes, and I would argue that the more severe your diabetes is, the more complex it becomes, the more exigent it is that you have in your life a specialist in endocrinology as well as your GP. And I like to think of addiction in a similar way. I think there are people who have perhaps a little bit of hazardous substance use. And I think it's entirely reasonable for GPs to be managing these individuals. And, and I know for a fact that they can manage these individuals entirely safely and appropriately. But when the severity of the substance dependence worsens, when the complexity increases, when the harms increase, I think you really do need to be involving in your care a specialist in addiction, either an addiction psychiatrist or an addiction medicine specialist. So
I have a
feeding back
slightly
to you, Richard, what's the
sorry,
difference between an addiction psychiatrist and an addiction medicine
yeah, well,
specialist?
I will get to that question, but I have a slightly different answer. But first, I want to say congratulations when we're doing this podcast specifically meant for members of the public for slipping in the word exigent. It's like you have a direct line to the people. It's like it's like being in the presence of some sort of great orator, some sort of man of the people.
Oh.
I think so. I actually think, and this GPs are better at managing diabetes than they are of addiction because of the stigma we mentioned before. So I actually think that basically everyone that is struggling with drug and alcohol use, unless you have an excellently trained GP with a sort of specialist area in addiction, should be seeing an addiction specialist of some sort. Not regularly, but at least once off for a plan. There are many public services that offer this as well. You can go and get a one-off assessment as a sort of plan for your GP. And that would be my view, that you should be seeing it if you are struggling with addiction and your GP is, unless your GP has this area, special area of knowledge, you should be seeing an addiction specialist. You don't need to see an addiction specialist weekly. And my view would be to go back to the diabetes metaphor. If you have frail diabetes, then maybe you have to see your endocrinologist quite regularly for a brief period of time, but then it gets stabilized and you're good. And that's what I say about having an addiction specialist is when you are in the throes of an addiction, you need to see an addiction specialist to get treatment plan to get out of it. But once you have achieved abstinence, you don't need to see your addiction specialist. Maybe you can see them yearly if you're desperate or wherever, but it's great to have an addiction specialist who knows who you are. When you are struggling, you can pick up the phone and call and say, I need help now. And that's what I think the value in having an addiction specialist is, having someone who knows who you are, who knows special area, that has a special area of practice in addiction, how to help you, and who you can get access to help when you need. But I certainly don't recommend that everyone with an addiction who is in recovery sees an addiction specialist regularly. But I think it's helpful to have someone you know. To answer your question, Ferghal, about what's the difference in an addiction psychiatrist and an addiction specialist, obviously addiction psychiatrist is a far superior breed of human. So I mean, I guess the answer is you can become an addiction psychiatrist.
Can I pick you up on that?
Yeah, I was going to actually ask.
Are you suggesting the psychiatrists are human?
So an addiction psychiatrist does a psychiatry training. And then that's 3 years of basic training, and then does advanced training in addiction. That's 2 years. In actual fact, only 15% of psychiatric trainees do their training in 5 years off, and that those years are expanded. So the vast majority of time, those years are longer than the 3 year, 2 year example I just gave. They are. You got to differentiate between a psychiatrist with a special interest in addiction and someone who has an addiction psychiatry certificate, which will be next to their letters and clearly available, because someone with a specialist interest in addiction, my personal opinion, does not have the qualifications and the expertise as a psychiatrist with advanced training in addiction. I think we have to be really careful there. And I think what you want is an addiction psychiatrist, someone who has that special area of knowledge. An addiction medicine specialist is usually a GP who then has done another 3 years of training, which is the entire length of GP training in addiction. But sometimes it is also a general physician who does 3 years of general physician training and then 2 years of addiction, or is it 3 years of addiction, beg your pardon?
I think it's 3 years of addiction.
It's
Addiction medicine training,
or a
3
public
years.
health specialist. Sorry, addiction medicine. And so I think there are two paths to essentially the same job. Often an addiction medicine specialist has a more focus on the physical health aspects, but in my opinion, a good addiction medicine specialist can cover all the sort of psychological aspects of addiction, and a good addiction psychiatrist can cover all the physical aspects of addiction. I think if you are properly trained as a subspecialist in addiction, you should be able to cover all of addiction, and that's whether you come from one side or the other, you should still be able to meet in the middle. Do you think that's fair, Ferghal?
Yeah, I do. I do think it's fair. I think people get het up on sometimes on these distinctions, but really, if you've got an addiction and you're being looked after by a specialist, you should expect to be cared for in a holistic manner by that specialist. It doesn't really matter, that distinction. But I do also agree with you that the distinction that does matter is whether or not that individual has had specialist higher training in addictions. That's the key.
That is,
because there are professionals who will say, "Oh, look, I have a special interest in addiction."
Yeah, but there's a very
it's not the
big
same
difference between the two.
Yeah.
What was the third thing that we discussed in our
psychologists or
famous
counselors? Tell us about psychology and counseling.
Yeah. So okay. So, So I actually say the term psychotherapist because that to me covers anyone that is offering talk therapy. The wanky medical term for talk therapy is psychotherapy. And a psychotherapist is someone who provides talk therapy. So that can be a counselor, a social worker, a psychologist, a psychiatrist. I think the thing is then that we are doing talk therapy. And there's a thing in talk therapy called the dodo rule. It's come from the Alice in Wonderland, where they had the dodo race. We're all winners and there are no losers when they run around in circles. And it was come from a psychiatrist in the 30s by the name of Ferghal. And he essentially said that no psychotherapy is better than another one. And the only thing that matters is that your psychotherapist is trained and that you like your psychotherapist. You and your psychotherapist get on. And whilst this isn't entirely true, it remains pretty true 90 years later. And so that, to me, what I would adapt the dodo theory of psychotherapy for addiction, I think it matters that whoever you are seeing, counselor, psychologist, social worker, psychiatrist, addiction medicine specialist can provide psychotherapy. GPs, some GPs, especially whoever you are seeing is trained in the psychotherapy they are offering. There's a difference between just having a chat with someone and someone providing you with psychotherapy, that you get on with them. And then I will add on my last thing, and is that you are able to be honest with them. Because really, I think the role for addiction counseling is someone that you are holding yourself accountable to. So I used to do some, when I was training, I did sort of pharmaceutical trials for drugs for alcohol use disorder. And some people would be on the placebo and some people would be on the active drug, but everyone had to see me every 2 to 3 weeks and they all got better and I wasn't offering any sort of advanced addiction psychotherapy. What they knew they had to talk to someone every 2 to 3 weeks about their addiction. They knew they had to be honest about it. And that in itself was what was really helping them. And that needs to be emulated. Someone that holds you accountable, really you're holding yourself accountable, but in front of someone else, and you know you're going to have that conversation. And it can't be a family member because that's just going to destroy your family relationships. That's my view about what the benefit of psychotherapy is. And then, of course, there is treating the underlying cause of our addiction. There are other benefits, but that to me is the main benefit of psychotherapy when we talk about addiction.
So I'd like to explore the difference between a psychologist and an AOD counselor, because you're saying that the dodo rule means it doesn't really matter what kind of modality we're using it, but I think the different professionals can use different psychological techniques, but nonetheless they are different professionals, and I think it's important for people, especially patients, to understand the difference between these types of professionals. So tell us about that.
No, I think the main difference you're going to find is PBS funding. So how much money the government's willing to give you back. So I beg your pardon, MBS funding. How much money the government's willing to subsidise your trip to the psychotherapist. And if you're going to go on MBS funding, by far the cheapest person to see would be a psychiatrist. The government subsidises psychiatrists better than they do psychologists, which is better than they do mental health social workers, which is better than they do counsellors. It's about training, but within psychotherapies, people are trained in different psychotherapies. So I could be a mental health counsellor with excellent training in ACT and mindfulness-based relapse prevention, which is a very common sort of psychotherapy designed to help people remain absent from substances. And I could be a psychologist with several degrees and no training in either of those two psychotherapies. So I think it does matter about the individual training and the individual psychotherapy you're going to. And that's where sometimes it can be useful to speak to someone who's very informed about psychotherapy. So a psychiatrist, for instance, an addiction psychiatrist like me, I will see someone, we will talk about their addiction. We'll also talk about what we believe is the underlying cause of their addiction. And I'll say, well, for this, I believe that you actually need someone specifically trained in this sort of psychotherapy. Here are a list of practitioners that are trained in this sort of psychotherapy. So there are certain sorts of psychotherapy that are targeted for different sorts of psychotherapies. I mean, different conditions. And, I think that is relevant in some cases, not to contradict myself too much by what I've just said before. In generally speaking, a counsellor has got less degrees than a psychologist or social worker who's got less degrees than a psychiatrist. But I don't believe that is an accurate predictor of competency when it comes to providing psychotherapy. I don't know what you feel about that, Ferghal.
I don't believe that paperwork actually determines competency. I believe it goes back to accountability and that therapeutic relationship and clinical experience, really. And tickets, we could get into the debate of whether or not tickets make the doctor or tickets make the clinician. I'm not sure they do. I think tickets get you across the door, but experience, peer review, and accountability make you the person you want to be.
Yeah, no, tickets, I think, as someone with just too many degrees, I think it's all they're implying is a deep sense of insecurity needing to acquire more degrees. So we've done addiction specialist, we've done GP, we've done psychotherapist. Should we talk about sponsor?
Let's do accountability partner first, because
this is perhaps the most nuanced one that I really want to
there is a
get
nuance,
across, because I think
I think
what the accountability partner is not an accountability partner in terms of keeping you sober. It's an accountability partner in terms of enacting the healthy lifestyle changes that are associated with us having a happy life when sober. So it's not good enough. I'm really of the belief that it's not good enough to devote your life to being sober. I want to be sober so I can have a great life, rather than having a life entirely devoted to being sober. And so I think the importance of an accountability, so how do I have a great life while sober? I enact healthy lifestyle changes that make me happy in my life. So I think that's exercise, meditation, having good sleep, having a purpose-driven life, having good social occasions. It's very hard to enact behavioral change, but we are social animals that are very prone to, getting influenced by our peers. And having an accountability partner that we do these social changes with really does help us enact those changes. So if I go to the gym on my own, sometimes I cancel, but on Saturdays I go with my friend Will, and I've never missed a Saturday. And I think this is really key, using positive peer pressure. And that's what an accountability buddy is. It's not about keeping you sober. It's about keeping you on task with these healthy lifestyle changes.
Should your accountability partner be your spouse?
I don't think that matters. Your accountability I like accountability buddy. Sorry, just to be clear about the nomenclature we're using. I don't see why I couldn't be a spouse. I actually think that having one, it's not really about having one accountability buddy. It's about having several. Accountability buddy in my mind is a stand-in for, I'm going to exercise. Who can I start exercising with? I'm going to do more social events, like join a chess club or join a community choir. Who will do that with me? I don't imagine it's going to be the same person across all these behaviors. It's trying to do things in a peer, with a peer, to try and make that behavioral change be more likely.
Yeah. Okay. So let's talk about the sponsor. First of all, we need to understand that a sponsor is a very unique individual who operates in a very specific context of recovery. But more so than that, it's also an individual who operates within a 12-step program. So I think we need to emphasize that a sponsor is not an accountability buddy. I can't say the amalgamation of that term. But secondly, a sponsor only works in the 12-step
You
program,
could say
not
that
in
ridiculous
all
word you
peers.
used earlier in the podcast. You can't say accountability, but you could say that.
Accountability,
that
no. So a sponsor doesn't actually work in any
Yeah.
other environment other than the 12-step program, and that
Yeah.
excludes peer support groups generally and also smart recovery. So I think we need to break that down a little bit.
Well, some other peer support groups do use sponsors. It's not purely 12 steps, but it is a peer support program, and Smart Recovery doesn't use them. And in case you felt we were being too self-serving when we talked about the need to have an addiction specialist on board, I can say that a 12-step programs and peer support programs in general are completely free, and they are the most evidence-based intervention in terms of cost and effectiveness in reducing addiction. So I would recommend a peer support program before I'd recommend a 12-step as an addiction specialist. I absolutely would. That's what the evidence tells us we should be doing. I recommend them both, but I really think that they're excellent. Part of the 12-step program is you have a sponsor that is someone who is much further along in their abstinence journey, and they are essentially a phone coach / in-person coach that helps you deal with cravings and manage the pitfalls of early abstinence. And I think they're excellent.
So I think the sponsor does, as you say, someone who's ahead of you in your recovery journey. And I think that's an important point to make, is when you're choosing a sponsor, you need to choose carefully. And you can go through a number of temporary sponsors, but it's really important to identify the qualities that make a good sponsor. Experience in recovery is one, but also knowledge of actually what constitutes the 12 steps is another one, because it's not just good enough to attend a 12-step meeting. The real work, the hard work of doing the steps usually occurs outside the meetings with your sponsor. Yeah.
Yeah.
So
what is 13 stepping? So,
you had to bring us down to the gutter, did you?
no, I think it's important to raise when we talk about finding a sponsor. So 13 stepping is essentially refers to when a sort of predatory older male sponsor looks for a younger female sponsee.
Well, a predatory sponsor looks for a victim sponsee. It doesn't have to be male, female.
Oh, I'm
yeah,
sure
you're right. It's
yeah.
13 stepping I also take to mean visiting various groups to actually predate on the vulnerable within the 12-step program. I don't think it's just limited to the relationship.
But I think when we're picking a sponsor as well, it shouldn't be a member of the gender that we are sexually attracted to. Yes,
I agree. Yeah. So really, I think now that we've discussed what a sponsor is and what an accountability partner is, we can see the difference, that they are distinct professional entities. So here's a question for you, Rich.
Also, neither of them are professionals as well.
Well, I view them as professionals because, well, do they profess? I mean, this is the thing. Okay. I mean, you've alluded to this, that 12 steps and peer support groups are actually evidence-based to be more efficacious than certain clinically trained individuals, in particular CBT
much to
focused.
our shame.
Yeah. I was going to ask you, so of those 5 groups of people, is there any way that we can say which is the most important?
No, so this actually gets asked to me quite regularly when I explain a lot of our recovery things. There is no most important. I think they are all equally as important. Actually, I'm going to take that back. I think I would put us, the addiction specialist, as possibly the least important. But I do, because maybe you have a GP that's well trained enough, but I do think even still you should be seeing an addiction specialist for a guideline plan at the start. I don't believe, people often ask me to do this when I explain my treatment plans for addiction recovery. Which part of this is the most important? No, it's all important. We're creating these support structures so that we can, treat every aspect of our life. So without the accountability buddy, we're saying goodbye to the healthy lifestyle changes that help us with recovery. Without the GP, we're saying goodbye to someone that's monitoring our whole health pattern. Without the addiction specialist, we're saying goodbye to that specialist addiction knowledge. Without the 12-step, without the sponsor, we're saying goodbye to the 12 steps. It's all, to me, it is all equally important. I don't think we should ever lose the frame of we're trying to do it all. Now, that's not to say I'm dogmatic. I have some people that just cannot do 12 steps for a variety of reasons. They try it several times. You need to adapt it to yourself. I'm not dogmatic, but I will not ever say that one is more important or less important than the other.
So they're all important. Really, I look at this as a jigsaw puzzle where every piece of the jigsaw has a potential role to play in any individual's recovery. And to neglect one particular piece leaves a glaring hole in the overall picture. So you need to have all the pieces fitting in. Are there any other professions that we haven't discussed in the fabulous or famous five that we also need to think about when we're thinking about recovery?
I'm sure you've got something in mind, Ferghal. I mean, I guess when it's this open conversation, there is, it depends on the person. There could be a wide variety of things. Social workers looking for housing and employment. It depends on the individual of the person.
Yeah.
So I think it's person specific, and I guess I would tie that back to having a good addiction specialist and a good GP trying to look at the whole person and trying to identify things. There could be a multitude of things.
I think the important point I wanted to make is that it's not. I don't want people to think that the only people involved in recovery are those in the famous five list. But it's just a useful way of conceptualizing the people who are really important and what we see as crucial to recovery. But, recovery is holistic, as you've said, and therefore anyone who can make a valid contribution to your ongoing health or improvement in function can be considered part of your team. So don't stop at the famous five, but certainly it's a good starting point.
I think this has been a long episode, but I think hopefully a very helpful one. So with that, I will say thank you very much for joining me, Ferghal, and this has been Substance Stories. I hope you enjoyed it.